Hello, my name is Amelia Francis and it's Monday the 27th of May 2013. This is my partner Greg and our patient Mr Jones, and this video is going to handle hospital notification and MICA handover.
Hello MICA.
Hello, I'm Amelia, this is my partner Greg, and this here is Adam Jones.
I'm Curly, you can call me Cam, it's nice to meet you.
Hi Cam, it's nice to meet you too. Okay, so Mr Jones here is a 45-year-old male. At about 3:43 PM this afternoon he passed out while he was up in the cherry picker and fell about 3 metres to the ground. He was unconscious for around 3 minutes. His main complaint at the moment is pain in his chest and ribs all down the left side and pain in his left ankle. The left ankle is deformed, swelling, significant bruising. There's adequate perfusion to the foot but minimal movement, and there's also a significant bruise on the left side of his chest, and he's complaining that it is very hard for him to breathe, and the only thing that is making the pain in his chest go away is when he stops breathing. The severity for both of them was 8 out of 10 pain, but since he's been given pain medication they've both dropped to 6 out of 10. He's not allergic to anything, he's not on any current medications. He has had no recent hospitalisations or surgeries of any significance. He is diabetic, however, but he takes no medication. For that, last thing he ate was a pie and a can of soft drink for lunch at about 1 PM. And he's had a bit of a cold for the last week, been feeling pretty lousy, and last night when he got out of the shower, he passed out briefly then. His blood pressure is 90 on 60, his heart rate is 124 regular, and his respiratory rate is 28. His temperature is 36.5, and his blood sugar level is 5.4, and his skin is cool, pale and clammy, and these indicate borderline to inadequate perfusion and moderate respiratory distress. He's also a little bit confused and has a GCS of 14. There's good air sounds or breathing sounds from the right side of his chest, but the left side there's not a lot of breathing sounds going on, and there's no air sounds in the mid zones and the base. So he's got a suspected collapsed lung, I'm thinking, and I gave him 5 milligrams of morphine at 1603 hours via IV, and then 5 more milligrams also via IV at 1608 hours, which were followed by 5 millilitres of just normal saline flush, which was also via IV.
Alfred on air, go ahead.
Hello Alfred, this is Morty Alec. We're coming with 45-year-old male Adam Jones. He has had a 3-metre fall from a cherry picker to the ground. He lost consciousness while he was in the cherry picker. He was unconscious for about 3 minutes. Suspected collapsed lung, severe pain in the left side of his chest and having trouble breathing, and also an injury to his left ankle, slightly deformed, swelling and significant bruising. He has no known allergies, is not on any current medication. He's had no hospitalisations or surgeries recently. He is diabetic, but he takes no medication for this, and his blood sugar level is 5.4. Last thing he had to eat was a pie and a can of soft drink at about 1 PM. He was given 5 milligrams of morphine via IV at 1603 hours and another 5 milligrams at 1608 hours, followed by 5 millilitres of normal saline flush also at 1608 hours.